First thing you want to do is grab your blood pressure cuff and your stethoscope. You want to make sure that the arm is being supported. You want to check to see if the patient's arm fits inside the range that you can see on the cuff. If the cuff is too tight, you'll get a false high reading. If the cuff is too loose, you'll get a false low reading. You will see on the blood pressure cuff there is an arrow, and above it says artery. You want to make sure that is placed on the brachial artery of your patient's arm, which you can see is right here. Now you want to place the blood pressure cuff on the patient's arm. So as you can see, I'm making sure the arrow is right above the artery. And then you want to take your gauge and clip it right on so that it is easy to see while you're taking the blood pressure. You want to make sure that the knob is turned all the way to the right, and take your stethoscope and make sure when you put the earpieces in your ears, they are facing forward, just like this. So now you are going to take the head of your stethoscope and place it right on the brachial artery. So now you want to start to pump up your blood pressure cuff. When you get to around 40 or 60 millimeters per mercury, you will start to hear the corticoff sounds, which is the noise of the blood hitting the walls of the arteries. Once you stop hearing the corticoff noises, you will pump the blood pressure cuff up 20 millimeters per mercury more. Now you will slowly let the air out, and when you start to hear the corticoff sounds again, you mark that number, and that will be your systolic number. And when you stop hearing the corticoff noises, you mark that number, and that's your diastolic number. What I got is the top number was 120 and the bottom number was 88. So that means her blood pressure is 120 over 88. And a normal blood pressure is 120 over 80.
A lot of times when you are taking a blood pressure, it is fairly noisy on the scene. Some people's corticoff noises, or the blood hitting the walls of the artery, are faint and hard to hear. One trick that I use and many other experienced EMTs use is to watch the needle tick. If you watch closely, between 160 and 120, the needle moves slowly. Once it hits 120, the needle will tick or move, then stop, move, then stop. Once the needle gets to around 80, the needle begins to move smoothly again. However, I let all the air out because now I have a reading of what their blood pressure really is. So now that you know how to take a blood pressure, I can explain to you what it means. So if you remember, earlier in the video, I told you to mark the top number, that is when you started to hear the corticoff noises or the blood hitting the walls of your arteries. And on my patient, her systolic number, or the top number when I first started to hear the blood hitting the walls of her arteries, was 120. And what this represents is this is the amount of pressure that is in your arteries when your heart is contracting, or in an easier way to put it is when your heart is pumping blood out to your body. Now, the second number I told you to mark was the number when you stop hearing the corticoff noises. And what this is, with my patients, was 88, and the average is around 80. And the diastolic number represents the amount of pressure that is in your arteries when your heart is at rest, or so doing nothing. So now I can tell you and give you an idea or an example of how we can tell if this is good or bad. So a lot of people are familiar with anaphylactic shock. So when you get stung by a bee, let's say, or end up eating peanuts and you're allergic and you have an anaphylaxis reaction, what happens is your blood vessels dilate. So now you have a bigger container with the same amount of fluid in it, and now the pressure is going to be less against the walls of the arteries. Therefore, the blood pressure is going to be lower. So we give the patient epinephrine or an EpiPen, and that causes the blood vessels to constrict or to get smaller. So now you have a smaller jar with the same amount of blood, so the pressure is going to go back up and be stronger against your walls of the artery. Therefore, your blood pressure is going to go back up.